Good afternoon, dear committee members, dear audience. Thank you all for attending this progress report. I'm excited to take you on a journey through my PhD research focusing on novel insights into the neurosurgical interventions for patients with drug-resistant epilepsy. But first, let me briefly introduce my findings of the first research topic. Periventricular nodular heterotopia is a congenital brain malformation often associated with drug-resistant epilepsy and leading to highly limited quality of life. Although minimal invasive techniques have emerged as alternatives, the optimal surgical approach remains unclear. In our systematic review, we showed that the MRI-guided laser interstitial thermal therapy has less effect, achieving only 36% of seizure freedom, comparing to the stereo-EEG radiofrequency thermocoagulation. In theory, this means that there is no evidence that the new technology, the MR-guided intervention, has better effects. Further research, including multi-center RCTs with standardized long-term follow-ups and comprehensive complication reportings, are essential, and for policymakers should support further investigation to gather quality of life data and guide future clinical guidelines. My name is Arashk Zabihi. I'm a neurosurgery resident and a PhD student. My vision is to improve the quality of life for patients living with epilepsy, and my mission is to investigate novel interventions to improve the standard of care of these patients. Currently, we have two specific goals. Our first project aims to investigate the outcomes of two interventions in a rare disease called periventricular nodular heterotopia. And the second project is dedicated to evaluating the outcomes of surgical intervention in mesial temporal lobe epilepsy. The first project, let's take a closer look at the first project, which focuses on investigating the safety and efficacy of minimal invasive neurosurgical interventions in patients with periventricular nodular heterotopia-related drug-resistant epilepsy. Epilepsy is a global challenge, affecting over 50 million people worldwide and around 37,000 in Hungary, and it contributes to several complications. PVNH accounts for 2 to 3% of all cases. The literature suggests that 60 to 90% could achieve seizure freedom through novel interventions. The open surgery is rarely performed due to the deep-seated and diffuse nature of the disease, which increases the risk of damaging eloquent brain regions. Recently, less invasive techniques, such as the previously mentioned SEEG RF-TC and MRgLITT, have emerged as alternative treatment options. However, there is a gap in the literature, as no clear consensus exists regarding the optimal surgical approach. We use the PICO framework to compare these two interventions and to determine their efficacy in seizure reduction and assess the functional deficits. We conducted a systematic search across 3 major databases with the finalized search key, found no previous meta-analysis, which highlights the novelty and importance of the topic. Out of more than 400 articles, we identified 15 eligible full text, which was included in the meta-analysis. Through citation chasing, we identified 1 additional article which were unable to retrieve. The first 3 figures, I will present the results of the study. The first figure shows the seizure outcomes between the 2 interventions. On the x-axis, we see the angle score, where angle 1 represents the freedom from disabling seizure. On the y-axis, we see the proportion of patients falling into each angle category. Among patients treated with SEEG RF-TC, 54% achieved seizure freedom compared to 35% in the MRgLITT group. The second figure shows the predicted probability of achieving seizure freedom on the y-axis, plotted against age at intervention on the x-axis. And it's also stratified by gender, female on the left side, males on the right. We see that the blue and the red lines have minimal slope, which means that age at intervention has no impact on the outcome. The last figure shows the last figure is the simplest one. It shows the raw treatment data, and we can clearly see the outcomes, as there is a 22 percentage point difference between the two interventions in achieving seizure freedom. The MRI achieves 36% versus the SEEG RF-TC 58%. The strength of the research includes being the first meta-analysis and including only individual patient data. The limitations are small sample size, including case reports and key series, and missing complications data. The Stereo-EEG RF-TC consistently achieves better seizure outcomes compared to the MRgLITT. The manuscript, I have finished the first draft and it's under internal review. The second project focuses on investigating minimally invasive surgical outcomes in patients with mesial temporal lobe epilepsy. Mesial temporal lobe epilepsy is the most prevalent form of focal epilepsy, affecting more than 12 million people, and despite adequate anti-epileptic drug therapy, more than 4 million remains drug-resistant. The gold standard therapy has been selective anterior temporal lobectomy and amygdalohypocampectomy, which leads to several complications. So recently, the use of less invasive techniques have increased, as they provide a targeted approach with decreased surgical morbidity. However, the literature indicates that varying degrees of neurocognitive deterioration. In this study, we also use the PICO framework to compare 3 surgical outcomes. The main outcome is measured by different neurocognitive tests, and we are also interested as secondary outcome in the rate of postoperative seizure freedom. The clinical implications include reduced treatment-related cognitive symptoms, and by identifying these symptoms, we can provide adequate postoperative patient rehabilitation. Regarding the progress of the second project, we found the topic feasible. There is no previous meta-analysis nor Prospero registration, and we plan to continue this topic after submitting the first article. In summary, both projects aims to address critical gap in the management of drug-resistant epilepsy. Thank you all for your kind attention, and I would like to conclude this presentation with one of my favorite quotes, which says, "You can't ever reach perfection, but you can believe in an asymptote toward which you are ceaselessly striving."
Congratulations to your nice talk. Questions? Are we talking about kids here?
No.
No? These would be adults?
These would be adults, yeah.
Yes.
There are also kids in the publication, but I have only one publication with kids.
I see. So
most of them are adults.
Yes. Yes, please.
Congratulations for your work, and I was wondering about that. You mentioned all these patients are suffering from drug-resistant epilepsy.
Yes.
And in the last years, there are new and new generation of anti-epileptic drug. And my question is whether these new type of drugs has changed significantly the ratio of drug-resistant epileptic patient comparing to the full population.
Well, the data of that 60%, approximately 60% of drug resistance is from the WHO from 2020, 2021 approximately, so it's not up to date. This might be changed, I don't know about it exactly.
Yes, please.
Thank you for the presentation. You mentioned at the end of the first project, I believe, that your meta-analysis has the strength of including individual patient data. Yes. How did you obtain that? Was it published or did you?
It was published. Yeah, it was published.
So did you need to ask for it from the authors, or was it available?
Most of the publication published it, but there were 2 or 3, I think 3 publications which we had to exclude. We tried to reach them. We wrote several emails and contacted them, but they didn't reply to us. So we included only individual patient data.